All right, with those COVID cases continuing to rack up, the risk may be even greater for those who vape or those who smoke.
And Children's Minnesota consistently ranks among the top pulmonology programs in the nation by U.S. News and World Reports. They are among the first health institutions to warn about vaping last summer. And here to talk about vaping and COVID-19 risk is Dr. Ann Griffiths, pediatric pulmonologist at Children's Minnesota, also part of the Centers for Disease Control, Prevention, Vaping, Lung Injury Response Group. Dr. Griffiths, thanks so much for being here this morning.
Thanks so much for having me.
Yeah. So why don't we just get started? What do we know about the link between vaping and COVID-19? Is there even one?
Well, just like COVID-19, there's a lot that we don't know yet about vaping and long-term effects, but we do know there's a link between vaping and chronic lung diseases like asthma, as well as impairment of the immune system. That's really concerning in the setting of COVID-19. We also know that nicotine in general can raise your blood sugar, your heart rate, your blood pressure, and these chronic conditions can be risk factors for severe disease with COVID-19.
Do we know if any of the younger people who have gotten the more serious cases of COVID, have we asked them if they vaped? Could there be a connection there? They may not have underlying health conditions, but maybe something happened there.
I'm very concerned about whether or not the right questions are being asked. Part of that issue is complex. If a patient is being hospitalized and critically ill, they may not be able to answer for themselves. Their family may not know if they're vaping. So I worry about the reports of previously healthy people with no underlying health conditions and whether or not they're actually vaping.
You were talking about vaping nicotine, but we know that some of the more serious problems have come from vaping the THC or the marijuana. What do we know about that association and COVID?
Yes, and California did report this year that they're seeing that severe lung disease associated with THC vaping again this summer, just like we saw last summer. And one of the difficult issues with this is that when you become very ill from vaping THC products, the symptoms can look a lot like severe COVID-19. And doctors really struggle with determining what's causing your illness, and that can delay appropriate therapy.
We've talked a lot about these flavorings. Where do we stand right now in flavorings in the vaping products?
Emerging research shows real concern that these chemicals that create the flavors can impair your immune system. And I always tell my patients that just because something is safe to eat doesn't mean it's something that's safe to inhale.
So much talk about COVID lately that I think sometimes we're forgetting to talk about some of the really other important health issues for young people. We've talked with Dr. Gigi about this before, but it's never too much to repeat. What can parents tell their kids? What advice should you give parents to talk to their kids about vaping?
Well, we know from the recent youth tobacco survey that this is extremely common in our children, and so they need to have this conversation and they need to have it frequently. Ask kids what they know about vaping. Ask them what they think about it. If they vape, they likely believe that it's safe. Many kids are vaping to cope with symptoms of anxiety and depression, and if your child has symptoms, we want them to see their doctor. Children's Minnesota hospitals and clinics have gone to great lengths to make that care safe, and so we want them to be seen.
Now, we know the kids aren't in schools together, and we don't know what's going to happen in the fall,
Right.
But even though they're not together, are these kids still doing it? Still vaping?
Absolutely.
So it's still something that we need to still continue to have that discussion. Dr. Ann Griffiths with Children's Minnesota, thanks so much. We really appreciate it.